Okay, so I wanted to do a little video of kind of just keeping kind of like a video library of what's fixing to happen, because I really don't know what's fixing to happen. But in the morning I am going for my double knee replacement for about 12, 13 years. I have been in pain, periodically, severely. Sometimes not as bad as others, depending on weather and activity and things that I've done. I've always been extremely active in things that I've done: hiking, kayaking, playing tennis, running, working out, stuff such as that. And I don't know if I damaged my knees by the things that I've done, or if it's just hereditary, or they told me probably about 15 years ago when I was 29 that my knees looked like a 60-year-old woman's, and I had my first knee scope when I was 29. Anyways, and I didn't want to believe it, and I just kind of ignored it and lived with the symptoms and would deal with the pain, especially after physical activity that would cause my knees to swell up pretty bad and just be in a lot of pain. So I went to see the doctor last October 2019. My knees were hurting really, really bad. I mean, they had really progressed a lot, and he had x-rayed them, and they were almost bone on bone. But there was I think he said 4 to 5 spurs on each knee, and he said that was like a massive amount of spurs. One of them was really large that he was concerned about. So I got a couple of shots, and he did discuss knee surgery with me then, and I wanted to put it off. I wanted him to do another scope, and he refused to do that. He said it just wouldn't work. He said it would just be a waste of money because it basically wouldn't work. So after contemplating it and being in more pain for another 3 months, there was a drastic change I felt in between the October time and the time I made another appointment in February of 2020. And he did x-rays again, and my knees had drastically changed, and they were absolutely bone on bone. And he was really surprised that they had degenerated to that extent in that quick a time. And he wasn't really sure why, but I knew, I told him that I had just felt that something had changed, and it was a pain that I had never dealt with before, which was every single night. I mean, just tossing and turning, laying in bed, and just severe pain that would throb through my calves, all the way up and down my legs, and felt like my knees were just really swelling a lot. During that time too, I also discovered a pretty large cyst. I don't know, I'll kind of show you, but I don't know if you can see, but I had developed kind of a pretty large cyst on one of my knees, which he said was fluid and would have to be taken care of during the surgery. But I originally was going to do just one knee, and then the other one after I'd recovered from the first knee surgery. But after thinking about it and contemplating it over and over again in my mind, I just decided to go ahead and do both at the same time. And I'd watched a couple of videos of other people that had them done, and both at the same time. And they seem to have recovered very well from it. And my doctor was very optimistic that I was young and, pretty active and strong, and that I would recover nicely and quickly from it. So, beginning tomorrow at 5:30, I will be going for my surgery. And so I will be trying to keep up a video diary maybe, and an update, and just kind of keeping in touch with what's going on from a day-to-day basis, just in the case or the event that somebody else might have to have the same procedure that I'm having. Maybe I could give them a little bit of insight and kind of what to expect, because that's what I was looking for when I was trying to make the decision of if that was the route that I wanted to take. So, hope you enjoy this video. It's just stupid information about me. Alright, see you after the surgery. Bye.